Odisha State Open University. Today with us, we are having one of the renowned cardiologists all over the world, Dr. Sambalpur. Good morning, Doctor. Doctor, can you please introduce yourself to the purpose about your branch and about your specialization to our viewers?
Thank you for inviting me to this lecture series. My name is Sambalpur. I am a cardiologist and cardiac electrophysiologist. I graduated from All India Institute of Medical Sciences, and from there on finished my internship in Brooklyn, which is in New York. From there on to University of Miami, which is in Florida, and then spent a good few years in practice in Kansas, and from there on till date I am currently in practice in Orlando, Florida, which is in the United States. My specialization is that in cardiology and cardiac electrophysiology. Many people are familiar with cardiology, but they may not have heard of cardiac electrophysiology. That specialization pretty much does not exist within India yet. There are a few people who train into that branch, but not many. Cardiac electrophysiology is a branch within cardiology or beyond cardiology, where we specialize about rhythm disturbances of the heart. People who do pacemakers, defibrillators, and also ablations, therapeutic options to take care of rhythm disturbances of the heart. Cardiac electrophysiology is specifically a branch which is concerned about electrical disturbances of the heart, and in short, I'm the electrician to the heart, as you may want to say.
Doctor, can you explain to us how the heart works?
So the heart actually has 4 chambers. Many people understand that the heart has 4 chambers. However, just like as we are in this room, the room is functional because it has some furniture, it has some plumbing, it has electricity. That makes this room functional, otherwise it will be just an empty, useless room. Similarly, the heart has 4 functional divisions to it. The first part is the muscle which beats. You can call it the pump. It is the one which actually squeezes the muscle squeezes and squeezes the blood of the heart out of the heart. So the left side of the heart pumps the blood to the rest of the body, and the right side of the heart pumps to the lungs. From the lungs, the blood gets oxygenated and comes to the left side, and the left side then pumps to the rest of the body. Part number 2 is the valves which open and close and kind of direct blood flow within the heart. These are almost like traffic lights. One set of lights turn green, one set of lights turns red, and then they switch. So it allows the blood to flow in a particular direction within the heart. It goes from the upper to the lower chambers, from the lower chambers to the rest of the body. That's how the valves actually direct blood flow. Third system is the plumbing system. Plumbing system as in pipes and tubes which actually supply oxygen and nutrients to the muscle to keep it healthy. That is the blood supply of the heart itself. You may have heard of heart attack or coronary attack. These tubes or these arteries are called coronaries. These are not veins, these are arteries. And they supply oxygen and nutrients to the muscle of the heart. And when there is a problem in this plumbing system, that's what translates to heart attack. There is a fourth system. The heart is beating to a rhythm, and we say our heart is beating at a heart rate of 50 beats or 60 beats or 72 beats a minute. That rhythm is being generated by an electrical circuit. That circuit is resident within the heart itself. It's not a nerve. It's not the brain controlling the heart per se. The heart itself is an electrically charged organ, and it has specialized cells which are electrically charged, which actually discharge at a certain rate. And the natural pacemaker of the body resides in the right upper chamber, and then it communicates to a switch box which is in between the upper and the lower chamber, and then the electricity through that switch box goes to the lower chamber and then makes the lower chamber beats. So the sequence in which the muscle beats is actually dependent on the sequence in which these electrical discharges are occurring. Without rhythm, there is no life. If the heart stops beating, that's because there is no rhythm. If the heart is beating too fast, that means the rhythm has gone haywire. If somebody say has a stroke and they cannot move their left arm, there is nothing wrong with the blood supply to that arm. There is nothing wrong with the bones or the muscles of that arm. It's just that the electrical communication between the brain and that arm has been severed by a stroke or whatever the trauma might have been. So similarly, the rhythm or the electrical communication of the heart is essential to life itself. The heart will stop beating if the rhythm goes haywire. And as a field of electrophysiology, my specialization is in this electrical department.
Yeah, it was nice hearing that, sir. So one more thing I wanted to ask you, that what are the basic ailments or common ailments that nowadays people face related to heart or cardiovascular?
So let's go by systems, it will be easier for you to understand. If it is the muscle of the heart which has become weak, that translates to what is known as heart failure. You may or may not have heard of congestive heart failure. What happens is the muscle of the heart, which is supposed to squeeze, and it almost squeezes 60% of the blood per beat. If it becomes weak, it squeezes less than 30% of the blood. It is also known as the word called ejection fraction. When the muscle becomes weak, patients tend to have symptoms like shortness of breath. They can't walk any distances. They become exceedingly dyspneic or short of breath. They also start getting fluid accumulation in the legs swell up. They can't eat much because once they start eating they feel full in their stomach. These are all signs and symptoms of congestive heart failure. Their lungs can get very filled up with fluid. Sometimes it is confused with pneumonia, but it's actually that they are having heart failure. The valvular system, which is the system number 2, those appear mostly as things like rheumatic heart disease in this country. If you have heard of rheumatic heart disease, the valves become fused. So the leaflets, which are supposed to open nicely and close, they become fused, so they can't open much, and they become stuck to one another. So they don't open very well, neither do they close very well. So they leak back, and they are not able to release the blood to the chamber which is below it. It comes as stenosis and regurgitation, and they present very similarly sometimes as palpitations. They can present as shortness of breath. It's fairly common in India to have rheumatic heart disease. Number 3 segment is coronary disease, or the third system, which is the plumbing system. You've heard of heart attacks. That belongs to plumbing department. It's a plumbing department problem. Trouble with the pipes and the tubes and stuff like that. If you have heard of cholesterol plaques, cholesterol problems, it's nothing but cholesterol building up in the tubes. It's almost like junk building up in the tubes, and you're clogging up the drain. And what happens is the blood, which has to travel from the source to the muscle to supply its oxygen, starts to get limited, and hence it starts to cry out for oxygen. Heart attack means that tube has suddenly become plugged up completely to an extent. Now the heart is suddenly short of oxygen completely and starts to cry out in pain. And it may present as chest pain, it may present as shortness of breath, it may present as squeezing discomfort, an elephant sitting on your chest. It can present as cough sometimes. It may present as nausea. It may present as atypical symptoms like I can't take a breath, I feel weird, I feel like I want to vomit, profusely sweating, can't pass out, and so on and so forth. 4th system is the electrical system. Electrical system presents mostly as my chest is beating really fast, my heart is beating really quickly. That is palpitations and heart racing. People suddenly passing out and falling down without a warning. That is usually an electrical problem. If you have heard of cardiac arrest, that is nothing but the heart beating very rapidly that it actually doesn't beat. So imagine 60 beats a minute looks like that, 100 beats looks like this, 200 beats, 150 looks like that. Imagine what 500 would look like. It actually does that. It is not beating at all. It cannot beat. It quivers. If you ever go to the operating room and when they have put the heart into bypass and after they are returning the blood back, the heart usually defibrillates, and if you feel the heart, it feels like a bag of worms. It just quivers, just like that. If it quivers, that means it is not squeezing the blood to the rest of the body, no blood supply to the rest of the organs, the body shuts down, the person dies. Cardiac arrest is almost always fatal. That is what my field is.
Doctor, can you please tell what are the recent advances in the field of medicine in cardiology?
So the advances in the field of medicine and cardiology and electrophysiology are, as we are going through different systems, I can tell you in each of the systems what has happened. In the field of cardiac electrophysiology, we can pretty much treat and cure almost any and every rhythm disturbance that you can think of. Most commonest rhythm disturbances which cause the heart to race is called supraventricular tachycardia, or SVT कहते हैं उसको. And 99% of all SVTs we can actually cure, which means we take, it's almost like playing video games within the heart. If I were to give you a point in space, and I ask you to define where that point is, you cannot define it, but if I were to take a beam of light, you can say it is somewhere in the point in the beam of light. If I take two beams, the intersecting point is where that point is, but if I take 6 of those, the fidelity of that point becomes very high. So imagine I have a catheter which has an electrode which is being tracked by those 6 beams, and I'm inside the heart, and in blind fashion I'm touching the inside surface of the heart and creating these points, and I connect those dots to create an electroanatomical geometry of the heart from inside. And then we put the patient into these rhythm disturbances, and I can see electrically how the discharges are occurring abnormally. You can locate to a 1 millimeter space where that electrical malfunction is occurring, and it's a matter of taking another catheter and buzzing that electrical mal circuit, maybe 5 or 6 60-second burns, and you're done. The electrical circuit dies down, and then you try to re-induce the rhythm disturbance and it's gone. 99.9% chance that the person will never have that rhythm disturbance in their lifetime without medicines. It's one of the rare branches of medicine where a cure can be achieved, not treatment, cure. That is not true for other aspects of cardiology, like plumbing disorders, जो heart attack, balloon stents, bypasses हैं. उसके लिए most of the time जब किसी को stent लगता है, किसी को bypasses होते हैं, that means they are committed to medical therapy for lifetime. क्योंकि जो disease process से वो blockages आते हैं, वो disease process are continuous. We are not stopping the disease process. We are just going around the consequences of the disease process. To slow down the disease process, things like aspirin, cholesterol lowering medications, blood pressure control, these things need to be done continuously. Plumbing disorders, नए तरीके के stents आए हैं आजकल. Drug-Eluting Stents were introduced somewhere around in mid 2000s, and over the next decade or so we have newer generation of drug-eluting stents which compare very well to even bypass surgeries. As you know, drug-eluting stents and balloons, they don't need to have surgery. It's a somewhat a preferred approach in many circumstances. However, in certain circumstances, जहाँ पे blockages are in very crucial areas, or there are too many blockages that cannot be handled by stents, in those cases bypass surgery is necessary. The bypasses could be off-pump, on-pump bypass. Off-pump bypass को कई बार beating heart bypass कहते हैं. There are some people, especially in Delhi I know, and some people in Bombay also, who specialize in off-pump bypass surgeries. The outcomes are relatively comparable. That is, it is not dramatically different, but one can assume that some of the neurological consequences will be lower with off-pump bypass surgeries. In valvular surgeries, there has been significant advances which have occurred. In the past, the only way to fix valvular problems was to open up the chest, take the old valve out and put a new valve in. Over the last 7 to 8 years, some of the valves, especially the aortic valve, एक valve होती है जो fills the gap between the left lower chamber and the rest of the body, उस valve को कई बार हम लोग replace कर सकते हैं without opening up the chest, either through the groin or making a small hole in the lateral part of the chest, and we can deliver a valve just like a stent into that area and deploy that valve. आज की तारीख में the survival of those valves is not known for beyond 5, 6, 7, 10 years maybe. But in due course of time, we can imagine that those valves will be made of much more durable material, and that it will be possible to have valve replacements without having to cut open the chest. TMVR, which is also transcutaneous mitral valve replacements, have started to occur. Transcutaneous aortic valve replacements, which is TAVR, which has been a fairly common procedure now over the last 6 or 7 years now in the United States. India में होने लगे हैं. I think it will become more and more common as time goes by. It depends on the anatomy of the valves. कई बार the valves are not capable of doing it that way. But in most circumstances, especially in elderly individuals who are at a very high risk for valve surgery, it has become one of the preferred approaches, especially in the United States, also in Europe. Valve surgeries still are the gold standard. I wouldn't say everybody is a candidate for transcutaneous aortic valve replacements, but it is fast catching up. Some of the newer advances in heart failure include some of the medicines which have done very well. But some of the other things which have started to take a significant amount of gain some ground in the United States includes left ventricular assist device. ये एक पंप की तरह होती है जो जब हार्ट फेल कर जाती है वो पंप को हार्ट में कनेक्ट कर देते हैं, and that pump actually is pumping for the heart and pumps the blood back into the circulation. It has a drive line or electrical tubing which comes out from the side of the body or from the abdomen, and it's connected to 2 battery packs, and the guy who goes around functions 8 to 5 job, walks around normally, and you can't even tell that they have an artificial metallic thing which is working for their heart. And then our institution has done almost about 55 to 60 left ventricular assist devices as of 2000 in last year. Then we may have done a good chunk this year also. We are also a very advanced heart failure transplant program. So transplant hoti hai ki jab we are not implanting anything, but we are taking the old heart out and putting a new heart in. That means somebody has died and has donated their heart, and a team goes to that institution where that person has died, harvests that heart, flies back while this person's heart has been taken out, and we put the new heart in and sew it back in place. Those patients also do very well. We do approximately 50 to 60 heart transplants a year in our institution.